if we can prevent falls, we can make staff jobs easier, actually. It lightens their load if they can just provide quality care and have less falls to deal with.
Welcome back to NextGen by NuCare, podcast for senior living providers looking for solutions to improve efficiencies and better outcomes for the residents. I'm your host, Joel Moyer, and I'm excited to welcome Sue Schneider and partner with her on a new consulting business called NextGen Provider Solutions. Sue's going to be talking about her experiences over the years as a nurse consultant and technologies that are starting to improve care and services. She's also going to be talking about how these technologies and systems that she's developed are improving resident outcomes and better serving even small communities by providing some services remotely that were not previously able to be provided. Hi, Sue. Thanks for joining me today on NextGen by NuCare podcast. Truly appreciate you taking the time and look forward to hearing your perspective on all things assisted living and your experiences here in Wisconsin as a nurse and nurse consultant. So let's kick it off by telling me a little bit about how you got into assisted living and what you've been up to.
Well, I have worked decades in long-term care, starting in nursing homes. But then had the opportunity to help an organization start an RCAC. So I helped them with that. As a result of that, we also had to work on the services that the CBRF was providing so that they didn't each put each other out of business, so to speak. So I got to focus on both entities. And I really saw it as a place where there was just a significant need to help staff and to understand what they were doing, because a lot of the staff didn't come with all of the healthcare experience in their backgrounds when they came to work in assisted living. So it was a great opportunity to just share a lot of my knowledge or experience with people to working in the industry to help them do better with what they were doing and feel more comfortable with what they were doing. One of the things that I identified early on was that it seemed like the staff and administrative and frontline staff in assisted living were a prime opportunity to share education with them and get them going on the right foot to provide quality care to residents, because they didn't know where to start. So it was to just help enlighten them just based on what I had all experienced.
Yeah, the resources have always been very limited. There's always been a few opportunities, but they've been sometimes difficult for providers to find educational opportunities. So, obviously the industry's been through a lot. We went through COVID and changed everything. What are the biggest changes you've seen in assisted living in the last few years?
The biggest changes I've seen are just starting with the needs of the residents that live in assisted living facilities. Having been around as long as I have, the people that are being cared for in assisted living now were people I was a part of caring for in nursing homes when I started. So that whole evolution of moving those clients or residents into assisted living, and but then when they get to assisted living, they don't have the same skilled services or skill sets to help care for them. So now staff are at a disadvantage because they aren't set up to succeed. And so that again is where my passion lies, is to help them understand what's going on with their residents and do better with them. So, in addition to that, staff is harder to find. Um, and as and there's transition with staff. Retention is low. Um, and so it's being able to educate and train staff because that supports retention.
Sure. So you've had the advantage, I guess. So since COVID in particular, some of these things have been exaggerated, that have become more prominent where we lost people that just didn't want to be in the industry because of the challenges and the stress level of people getting very sick and passing away in communities. Um, and it also feels like people have stayed at home longer as well. So as you said, that they're not coming to assisted living communities as early. They're stayed at home oftentimes through COVID. They brought resources. They figured some things out how to do it at home, and now we're coming in with higher acuity, more diagnoses, more challenges. Um, so therefore, what you're saying is there's more education, more training, more tools that the caregivers need.
Absolutely. And surveyors, not to throw them under the bus, but surveyors are having higher expectations. Be- and that kind of just goes with the territory of them needing more care. Then staff do need to know more. Um, and they're held accountable to that, but don't always know how to get to that point to to be compliant.
What are some of the tools, training, and other things that have really helped communities? So you have the advantage of not just going into ones that you directly manage, but as a consultant, you're going into a variety of different settings, a variety of different companies, and the way they go about doing business. So tell me what are some of the things that have really been game changers to help improve, care and services in some of the communities you've been in?
Definitely the use of software, so electronic medical records, because a lot of the programs, and I'm there's not one program that they all have a similar feature where you can assign tasks to staff, to the caregivers, and that can include the behavior monitoring, the health monitoring, and identifying condition changes sooner rather than later. So that's huge. And those software programs afford the facility the opportunity to create that. And it's also afforded me the opportunity to audit some of that remotely and make recommendations as to what staff could be doing to improve the health monitoring and quality of care as a result.
Yeah, so as I think as providers, one of the advantages, like you said, is by being able to look at information remotely, um, you're able to do it more efficiently and more cost effective for many providers and do more, as opposed to having to drive facility to facility and spending more than half your time on the road. Um, and gathering more information so that when you do go visit, you have better information, you're prepared for that visit. Um, Are there any other, technologies? Yeah, we've had many conversations about, where things are going and the need for, additional technologies, beyond just the electronic health record. Are there any other things that you're either have seen in place or have heard about or are considering using?
Um, I've seen I've seen there are a variety of products to monitor falls or mobility. I've also seen devices, and I apologize, the name escapes me, but there are devices that are placed in around toilets, so staff know when residents are needing to be toileted. There's a lot out there, equipment, that can help notify staff and put them ahead of, waiting until the resident falls. And now our work went from this to this because we weren't proactive.
So tell me about some of the technologies that you've seen having the advantage of visiting multiple companies, multiple properties, not just ones that you manage. About some of the things that you've seen that have really made a difference in providing better care and services.
I definitely think there's advantages to having electronic medical records. That soft and all the softwares I've seen, the products I've seen do include some type of opportunity to enter tasks for staff to do and document on. So then using that space to then incorporate health and behavior monitoring so that staff are documenting on that routinely. And as a result of that, are then maybe identifying possible condition changes sooner rather than later. And Um, I've actually seen facilities improve with that when I help them establish that and then come back months later. I see them doing it and things are
So how has that made your job more efficient by having electronic health records?
it gives me the opportunity to remotely do some auditing and provide support that way. Um, to help the staff identify opportunities for improvement as it relates to that. Um, and the the kind of coolest part about it all is that staff often do when I'm talking to them, even remotely, they're already doing a lot of the things I'm suggesting. They're just not capturing it. And so then it doesn't get done consistently. So now this provides opportunity for consistency and continuity.
No, that's great. The efficiency of you being able to look at that information remotely, and then if when you do either talk to them, um, do a Teams meeting or go on site, you already have the information you need. You're not having to dig through records once you get on site and spending, half of your day driving around between buildings.
Absolutely. It allows those interactions with facility staff to be much more focused and efficient.
So tell me, I know that you've been doing this a long time, and now, we're actually partnering together on our new venture in consulting um, with NextGen Provider Solutions. Tell me about some of the changes that are happening, from a consulting side, what changes are happening in the industry that have really precipitated the need for those changes.
There are higher acuity, which we had mentioned earlier, is incredible and it's going at a fast pace. So being able to help staff quickly and more often, um, and then being efficient about it because they need to spend a lot more time providing care also. The other advantage or the other change I see is the documentation has to be there, yes. And we've already talked about ways to possibly address that, but also the opportunity to have staff be more proactive with support from someone like that's what I do in some of the facilities I go to is help them be forward thinking, proactive. Um, so
One of the other things that's pretty neat about what we're trying to accomplish is really focusing on smaller communities, 20 beds or less oftentimes, and those individuals don't always have the time or ability to go out and seek out new systems and technologies and other things. Um, so we're going to be able to bring some of those opportunities to them to test things out, review things, introduce them to systems that are working elsewhere as well. One of the things that we are in the process of implementing, getting up and going as part of the consulting is this VR headset for falls evaluation. Um, and I know we're both excited to receive our training and our getting started using that with residents. Tell me about the risk of falls and where that falls into why that's important in assisted living communities.
Significant. Um, because why it's so important is because if we can prevent falls, we can make staff jobs easier, actually. It lightens their load if they can just provide quality care and have less falls to deal with, because every fall goes from they fell, but now we've got to do all of this to follow up the documentation, the communication, the monitoring, updating the service plan. I mean, it just, right? And then you might have to report to the state.
Yeah, if there's a hospitalization or something else, and you don't know how that's going to work out, and if there's an injury, if there's something that is going to be a change of condition that makes it so they can't come back, or they have to come back with assisted devices or a rehab program or something else. So yeah, I'm very excited about it because we can go in and do a baseline assessment of all the residents and tell you who the fall risks are on a more objective basis, because a lot of times you're relying on interviewing the residents or talking to staff of what's been going on, and they aren't always fully disclosing things that might be embarrassing for them. And that's okay, but we're just trying to help them. And if we don't have the information, we can't help them. So this can objectively do a full assessment, using technology in about 10 minutes, give a baseline of where they're at, and then come up with a plan for, some training exercises to hopefully improve, their stability and balance and things like that. And if it's too much for our system to use, we can bring in, a physical therapy company or someone else, an outside professional to truly help with some of the more challenging situations. So that's really exciting. Um, we're going to be, evaluating this over the next several months and offering that service to clients as we're working with those communities as well. In addition to that, what are other ways that you can that that we can change the way we go about doing consulting to help smaller communities and help more of them?
Well, I think because a nurse brings a slightly different perspective to what's going on with the resident, what's contributing, and some of the potential risks that lie ahead. Um, a nurse brings that perspective to be able to help staff understand that moving forward. And so it is difficult for small organizations, mom and pop facilities, to have a nurse there full time. Reimbursement doesn't support that. Um, and the workload maybe doesn't necessarily support a full time.
Yeah, and it's really difficult to hire a nurse for 4 hours or 6 hours a week. Who's out there? And it's hard to find those people. They are there, and we will hopefully be finding some of those people who are looking for additional hours, and maybe their schedule needs to be more flexible so they can only work in certain days of the week, certain hours, and don't want to or can't work a full 40-hour work week or travel around. So yeah, so the remote monitoring that you talked about of medical records, of care plans, of medications, medication interactions, um, psychotropic med reviews, all of the things, incident reviews, talking to physicians. There's a lot of different things that can be done without physically, you know, hands-on touching a resident. And even with telehealth, you can get a resident in front of a camera and, do a quick evaluation. If there are some things you need to, see or talk to the resident about, there's a lot of things that can be done remotely. without these small communities having to employ a nurse, which is difficult to do. Um, and then, of course, the systems that you've developed over the last, 20 plus years for monitoring all of these different health conditions and regulatory compliance and all of those things, taking those and systematizing them and putting those on the back end so that as we're providing consulting services, it's consistent across the board as we're doing it. And, with you leading that charge and us being able to add some additional consultants, with your, you know, 25 years plus of experience, um,
You're
we're
so
really
kind.
excited to partner up with that. So, um, I'm really looking forward to the new things we can do and evaluating some of the additional technologies that you've seen, fall related or health monitoring, remote patient monitoring, fall detection, location, call systems that are more advanced that integrate in with the medical records so that when you go answer a call, if there's cares that need to be done, you can do them, record them, and move on and not have to go separately and log into your medical records. So the integration of these technologies is pretty exciting. Um, and in my background as both a provider and being in the on the tech side of senior living for so many years, I'm really excited to now be partnering directly with you on some of these things and really having been in the small community and memory care and higher acuity space for so long. These technologies are not just fun options anymore. They're going to be a requirement in order to make sure we get the best outcomes and do it in an efficient way so that the providers can actually implement these things. And, we also have the higher cost of labor and things like that have hit the communities. As you said, it's harder to find people. Um, and you have to pay them more than you have in the past. Uh, and all those additional costs, you have to then be able to make sure you're getting paid for all the services that you are providing. And that's where making sure you have these systems.
Exactly. I think, um, again, I think staff sometimes are doing some of the things we suggest, but they have no way to capture that. They have no way to, they don't know that that there's reimbursement to support that because they, it's just amazing to be able to work with people and hopefully, bring the experience and knowledge from my career to share that with people to help enlighten them to make their job more enjoyable really and to be more it enhances the quality of care for the residents and then ultimately also supports compliance.
Yeah. So um, I just did a podcast with the CEO of Stephen from Icon Financial Services, and he talked about a system he put in trying to capture that undocumented care. Um, and he was able to add hundreds of thousands of dollars of revenue on a monthly basis by putting in the systems to record that care. And the thing I like to remind, the staff, the managers, the people involved, that if we can record all of the things that you need and can capture, the care that's being provided, it makes it much easier to show our families and our residents why we have to charge what we have to charge for the care. And then if we're getting reimbursed for that care, then we can make sure that we have the number of team members on staff at the time in order to provide the care. But if we don't know the care is being provided, we're not getting paid for that care. It's difficult to have the staff available to provide care we don't even know is being provided. And
Right, there's always a bigger picture that I think that's kind of the beauty of or what I really appreciate about consulting also is that you can help people see the bigger picture. It's not just Billy fell and now we got to fix that. And And it's so frustrating because he falls all the time. But, there's a bigger picture to this whole thing. It might be reimbursement. It might be, a more integrated team, you know, other team members coming in, therapy, et cetera. So it's helping them realize they're really not alone in this, and they, there's opportunity. They can do great things.
No, it's so great to hear, the passion you have for it, and I'm excited to be partnering with you on the NextGen Provider Solutions as we're moving forward together and truly trying to serve even more communities to provide more improved outcomes across the board for residents and provide tools and training and things for the care team so they have what they need to do their jobs efficiently and to the best of their capacity. So,
Well, I welcome this opportunity because it just allows, us to help more people. And that's what it's all about.
well, Sue, thank you. Appreciate your time today. It was great to have you on the podcast, and look forward to partnering moving forward and all the great people we can help out. Thank you.
Great. Thank you. I'm excited too. Thank you.
Susan, if people want to get a hold of you or check out all the great services, what's your email address and what's your website?
The email address is susan@nextgenps.com, and the website is nextgenps.com. So you'll see the services, or you can reach out and ask questions via email, and I look forward to talking to a lot of you about how we could support you moving forward.
Well, thanks again for your time today, Sue, and have a great rest of the week.
Thanks. You too, Joel. Thank you very much for the opportunity.